So I'm going to be going over the equipment you need to do the ABG procedure. So for our PPE or our protection, we're going to make sure we have eyewear. If you don't have glasses, make sure you have some goggles, a surgical mask, and then gloves. And then obviously making sure to wash your hands before you put that all on or use hand sanitizer. And then we have our ABG kit. In our ABG kit, we have the syringe, the option of a long or a shorter needle, gauze to put pressure after we take the needle out, or while we take the needle out, iodine, but we don't typically use that, alcohol prep pad to sanitize the skin, Band-Aid to put on afterwards, an aeration cap to get all the air out of the sample to keep it contained, and then patient label, and a biohazard bag to put the sample in to go run it in the machine. And over here, some cases we might use lidocaine for pain control. If we use the lidocaine, we would use the needle from a TB kit, and those are supplies we need for our ABG.
This is a demonstration of an ABG stick. When you first come into the room, make sure that you have your patient label so that you can verify the patient and verify the procedure that you're going to do so that you have the right blood for the right test. And make sure you have your ABG kit, and then if you need it, your lidocaine and your lidocaine needle. Hello, my name is Megan Riley. I'm the RT, and I'm going to be performing an ABG today.
Okay.
Can you tell me your name and your date of birth?
Nina Smirzek, December 4th of 97.
Wonderful. After you have your patient verified, you go over and you wash your hands. For this procedure, you're going to want eyewear, which I have already, and then a mask. And then gloves. All right, and then you're going to want to explain the procedure to the patient if they've never had one done before. Have you ever had an ABG before?
I have not, no.
All right, so what we're going to do is we're going to put a needle in, and then we're going to draw from your artery. So let's lay out the things that we need. All right, so we're going to perform an Allen's test, and this is going to just test your circulation. All right, okay. So I want you to make a fist really tight a couple times. There you go, and open your hand. And if you have good circulation, then your hand is going to turn pink within 3 seconds, and you have good circulation. Beautiful. All right. We're just going to alcohol swab this and keep it nice and clean for when we poke it. We're going to get our Band-Aid ready and our gauze for pressure. Now, we could use lidocaine, but today we're not going to. But if we were, we would open up our needle. And what we would do is we would come in and just to the left or the right of the artery, we would insert the bevel just underneath the skin, make a little wheel, and then we're going to massage it in.
Okay.
All right. Now it's going to feel like a sharp sting.
Okay.
Good job. You see the flash and it's going to fill up. And since it's from an artery, there's pressure in making the blood move around, so the syringe is going to fill all by itself. And because there's lots of oxygen in there, it's going to be a bright red color. Alright, then we're going to put pressure on that. And we're going to close the needle, not on our skin or on anything soft because we don't want it to slip and poke you again or poke me. Then we're going to put a band-aid on that, and I want you to hold pressure on that for 5 minutes until the blood stops bleeding. Alright. Now we're going to take this off, put that in our sharp spin. Put our cap on there. Alright, we're going to push the air into our plug.
Okay.
Put our label on it. And take it off for testing.
Hello, so this is for an A-line draw. Equipment that you'll need for that is going to be your hand sanitizer to wash your hands before you go in the patient room. And then you'll need your gloves, as well as a mask and eye protection. And then equipment needed for an A-line draw is going to be sterile gauze, depending on your facility, an alcohol wipe, patient label to identify the sample and the patient, a 3 milliliter waste syringe, and then prep the syringe to make sure it will fill up nicely. A 3 milliliter ABG syringe. We'll prep that one again. A de-aerator cap. Some extra gauze. And then a waste cup for when you clear the sample line. So when you go in and do this procedure, you will want to wash your hands, glove up, get your mask and eye protection, and then when you enter the patient room, you're going to want to introduce yourself to the patient and verify the patient is the correct patient. So I would enter the room. Hello, my name is Michaela. I'm an RT. I am here to draw a blood sample. I would ask the patient for their name and date of birth and verify that information with my patient label that will go on the sample syringe. So then we will move into drawing the actual blood sample. For this, you're going to want to remove the blue cap to the syringe. And before we do that, before we draw the sample, we're going to want to verify that the saline bag that the patient is hooked up to, we're going to want to verify that it is above pressures of 300. If it's not, just give it a couple more pumps to make sure it's above 300. Okay, so we want this cap to remain sterile, so when we take it off, we're only going to grab on the outside and avoid touching the inside of the cap. And we're going to place it on the sterile gauze so it stays sterile, and we're going to leave it alone. Then, depending on facility, you would take your alcohol wipe and wipe the inside of the port. For this demonstration, I'm not going to do that. So, we would take our waste syringe and hook it up to the A line. And then we want to turn the port off to the saline bag. So we're going to turn the port off. And that way it's open to the patient to draw our sample. And pressure from the patient, it should fill the syringe on its own. And then once we have our sample, our waste sample drawn, we're going to 45 the stopcock, and we can remove our waste syringe, making sure not to touch the sterile port. Then we can grab our ABG syringe, hook that up to the port, and this should fill on its own as well. Once you turn it back off to the line, it begins to fill. And then 45 it again, turn it off to the port here so you can remove your sample. I'm just going to set this aside for right now on a piece of gauze. I'm going to draw or pick up my cup, and we're going to flush the port. So I'm going to turn it off to the patient. So you just want to do it until it's clear, the port's clear. And then you'll replace the sterile cap, making sure to keep it sterile. And as you can see, there's a little bubble of saline there, and that's to help prevent any bubbles from going to the patient. So once the cap is on, we can turn it off to the sample port, and then we can flush the line to the patient. And you usually flush about 3 seconds or until the line is clear. Then we'll take our sample syringe and place the deaerator on top. Get any bubbles to the top, push the fluid out, attach our patient label to the syringe, and we'll put in a biohazard bag and then go run the sample.